Hi everybody, welcome to this episode on health insurance. I am Jennifer, and together with my husband Daryl and our dog Cece, we are two gringos on the Gulf. Welcome to the channel. As promised, we put together a little video on our experience with buying health insurance here in Mexico. I want to briefly discuss what we will review. First of all, we are not experts in insurance by any stretch of the imagination at all. We are not even knowledgeable on the subject, to be honest. We are presenting our experience with buying health insurance. Use this as a springboard for your own research, which I encourage you to do. So we will start by reviewing the original quotes I received back in 2022. Is when I started looking. We're going to compare those quotes to the cost of the national health care that we can buy into here in Mexico as temporary residents. We'll review our coverage and kind of review the waiting periods that we have. I'll explain that more kind of part and when we get to that slide. And then we'll move on to the quotes we got for 2023 and our most recent quotes for 2024. We'll look at these new quotes, we'll compare them to the current kind of cost of the national health care. Again, we'll get to the kind of part when we get to that slide. And I think I've shared some copies of some brochures and things that I've received. So I really don't want to waste too much time on this presentation, so we're just going to move along quickly here. So this is it back in 2022. I got quotes from MetLife, Pacific Prime, and Health Itinerary. I just copied and pasted our original quotes that we received, so that conversion into Canadian and US dollars are just below it there on the screen in front of you. So the top chart is all in pesos. So we'll go over a little bit about what each line item is so you can follow it along a little bit. So the top line for each company is the premium. So that's the cost of the premium. Now you'll notice in Pacific Prime, there's 1, 2, 3, 4, 5, 6, 7, 8, 9, like 9 or 10 different premiums, but because they have different packages when I originally put this together, I put all those packages in there, even though there's no way we would buy the 144,000 peso package. But that's what you're looking at there. So the premium is the top line. That's what it would cost for two of us for an entire year. And then the sum is how much you're insured for. So in total. And the deductible, so a lot of these insurance companies offer a deductible, so that's what you have to pay before they'll take over the rest. And now the copay and the cap kind of go hand in hand. So after you pay your deductible, you then pay a 10% copay. So whatever the costs are after your deductible, you're paying 10%, capped at whatever the cap is. So for MetLife on the screen there, the first one, it's a 10% copay capped at 60,000 pesos, okay? So you won't pay more than your deductible plus 60,000 per illness, usually. Now, most of these don't have dental, outpatient, or glasses, but they were part of my original, when I was asking if they offered these. Some did, some didn't, some were like insanely priced. So we initially bought healthitinerary.com insurance, which is the third company there, and we bought the last package. So again, they offer different packages. So we ended up paying 19,000 pesos for the both of us, or 900 US dollars, or 1,200 Canadian dollars. 40 million is the sum insured. Our deductible is 30,000. Copay is 10%, capped at 40,000 pesos. So we almost said, okay, these prices are so high, let's just buy into the national healthcare. And so Health Itinerary sent it to me and said, okay, here it is. So here we go. Here's the costs. And it's based on your age range. So at the time, it would have been 9,550 pesos for me and 9,950 pesos for Daryl. So a total of 19,500 pesos for the two of us for the year. I don't think I did the exchange rate on that. Well, kind of. So I did the exchange rate on each item. So 9,500 should be $500, a little less than $1,000 for both of us US, and 11, 6, 12, just over $1,200 Canadian for the two of us back in 2022 to buy into the national health care. So it was explained to me the difference. So national health care, we would have been covered for absolutely everything. Hospital, emergency, doctor's visits, everything. Whereas private health care, we don't have any outpatient. We do have to, pay for the doctor out of pocket. But the wait times for the public health care are ridiculously long, which our friends have experienced. Jorge and Jessica, they tried to make an appointment and it was 3 months out. Plus they're understaffed and under-equipped, whereas you would get, I keep hearing about the stellar private healthcare that you receive. So what our insurance company did was raised our deductible to make it more, to bring it in line with the national healthcare costs. It's called IMSS, Instituto Mexicano del Seguro Social. So the Mexican Institute of Social Security is what that stands for. So she brought and that's why we could afford it. That's why we went with the private. I mean, we like the idea of the private better. It's not so much expensive to pay out of pocket. So that's what we did, and that's how we afforded private health care. Now we'll go on to our policy, which is all in Spanish. So, I mean, you could screenshot it and then translate it if you like. I'll just go over it very quickly. Some of the coverage. So amparada means you're covered. So hospital expenses, medical honoraries, auxiliary diagnostics, medicamentos, don't know, medicines. We're not covered for medicines. Maybe when you're in the hospital. Ambulance, hospital network. Don't know what tabula dar is. And yes, there is a deductible. Telephone assistance, trip assistance, prosthetics and apparatus, orthopedic, rehabilitation, dental treatment, that's probably in the case of an accident or something like that, and reconstructive treatment, and aesthetics. Again, in case of an accident, there is no cosmetic things covered. Vanguard procedures. What's another word for vanguard? Like cutting edge procedures, psychiatry and psychology, dental vision. Our original plan did have dental and vision. Now, the deductible we pay, the 30,000 pesos, is omitted. What's another word for omitted? I don't know. But you don't pay the deductible if it's in the case of an accident, if the expenses are in the case of an accident. Okay, so you can see I don't understand everything. So dental and vision, I'm not going to go and translate all of this, but basically you got maintenance every 6 months, so like a cleaning. But you had to go to their dentist, and we did not like the dentist at all. So the next year I'm like, you know what, I'm not going back to that dentist. I'll just pay for it out of pocket, and it was not that expensive. So it's not really worth the extra cost to get dental and vision. And then we did try to get vision, but again, you had to use their vision company. And I didn't know that. I just went and got glasses and then tried to submit, and they're like, no, you have to go to this company. I'm like, oh, I did go to this company. And they're like, no, you have to submit through them. I'm like, so I got no money back for my glasses. And then so we tried with Daryl, and it was only 2,000 pesos on a 7,000 peso pair of glasses, which means it would have cost us 5,000 pesos for his glasses. You can get them cheaper here at Costco, just like back at home. So we never bothered. So that was pretty frustrating. And again, the coverage you get is not worth the premium that you're paying for. So we'll move on to wait periods. Now, the kind of part here, the caveat is, I looked high and low, and I know she sent me a document on illnesses that had a waiting period, but I could not find it. So what I did find was like another company that had sent me the wait periods. So I'm going to assume they're similar lists. So I wanted you to see something to get an idea of what to look for. And I want to throw out at this point, like Daryl and I, we have no pre-existing conditions. We have no chronic illnesses. So these waiting periods really didn't worry us too much, but I wanted to share them with you. I felt they were important. They might be relevant to some of our subscribers. So we're going to go over some of them. 10-month waiting period. So for 10 months, you have to wait 10 months for any congenital conditions for those born during the policy period. I don't think our audience is going to be having any babies, but I mean, it's just part of this wait period here. Premature newborns, maternity, economic support during childbirth and cesarean section, complications of pregnancy, childbirth, and puerperium. Puerperium has something to do with the placenta. So not too many health insurance companies are going to cover pre-existing conditions. So if you have a baby in under 10 months, then they're going to assume that it was pre-existing and they won't cover you for it. I think that's the idea behind the 10-month waiting period. Again, I don't think this is going to apply to many of our subscribers. 12-month waiting period on peptic ulcers and all types of cancer. A 24-month waiting period on treatments to hernias, tonsils, adenoids, cataracts, varicose veins, gallbladder, knee, spinal column, nose and or sinus injury, gynecological and prostate conditions. A 4-year waiting period on this. I don't understand, guys. I'm sorry. I'm including it, but I don't understand it. 6 months with a negative ELISA test. An ELISA test detects bloodborne viruses. 4-year waiting period for AIDS. So if any of these are concerning to you, you may want to take that into consideration when looking for health insurance. So again, I did not really go too far for quotes in 2023. Alpha Medical is sold by a good friend of ours, his wife. well, I guess she's a friend as well, but so I said, you know what, I might as well buy health insurance from you. So I had her quote, not realizing that it's going to be so significantly higher, and I felt bad, but it was a big difference. So that quote was 36,000 pesos, or 2,000 US dollars, or 2,800 Canadian dollars. And Health Itinerary, the coverage did not change whatsoever, and it went up to 25,000 pesos, or 1,400 US, 1,900 Canadian. You can see on the Alpha Medical side that the deductible is higher and the cap is higher, but the sum of insurance is more. So that was it, and I just included this brochure to show what the coverage was from Alpha Medical. So I would like to also point out that they're making you all pay for maternity, and I don't think that's fair. A woman without a uterus is not going to be giving birth, so they're like, it's just covered. It's just how it is. So basically, every covered person is paying for any person that gets pregnant. So, but nothing you can do about it. So there it is. 2024 quotes. I did go out to quote. So now compare. They were pretty pushy, and they're like, "Oh, we're cheaper. I know we are. They were not. I mean, they came close, but they weren't cheaper. Oh, another typo there. Let me just quickly calculate here. 1,700 US. So okay. Now compare was 1,900 US, 2,600 Canadian. Pacific Prime was 2,700 US, 3,700 Canadian, and Health Itinerary still coming in cheaper at 1,700. My apologies. 1,800 if you want to bump it up, and 2,400 Canadian. Now compare. They had a huge brochure, but I could not find anywhere in that brochure where it was they listed the deductible, the copay, the cap. There is no dental, outpatient, or glasses. And I'd have to point out, this is for accident or emergency only. It would not cover in illness. So if you got cancer or something, they're not covering you. Pacific Prime, it's a big expat company, I think. And so 16 million pesos, remember, is their coverage. Deductible is 82,000, so a higher deductible. No mention of copay, and I'm wondering if they don't mention it, if it's just they don't have it. I don't know. So again, the only difference now to the coverage with Health Itinerary is we got rid of the dental and the glasses because, as previously mentioned, it's not worth it, and it still went up. Okay, moving on to the next slide here. So this is now compare. This is what's covered with them, just to give you an idea. And this brochure is listed in US prices. I converted it on the chart on the previous slide. And I want to move on quickly to the summary. So this is what we paid for all the years, and every year was with Health Itinerary. So 19,000 pesos the first year, 25,000 pesos the next year, and 29,000 pesos the following year. So that's a difference of 10,000 pesos. Significant, yeah, okay, but nothing compared to the last what we paid in Canadian dollars. Okay, so it started out at 1,200 Canadian dollars, and we ended up doing 2,400 Canadian dollars. That's doubled. So this is wherein lies my concern. It's in the exchange rate. I'm earning Canadian dollars and I'm not getting as much for it as I used to. So if this trend continues, I don't know if we're going to continue to be able to afford private health care. I just want to point out that internationalhealth.com, they declined to quote us a price because I did provide them with the health itinerary price. And they said, we sell international health insurance only, which means that we sell insurance that offers worldwide coverage, and hence they come with the higher premiums. That's not what I'm looking for, okay? So that's why all these premiums are so much higher. Okay, so my thoughts at the end of it, I don't want to spend too much more time on this, but our coverage is not great. We wanted, it would be great to be covered to the hilt, but as long as we're covered for something that we don't know, you know, insurance is something that you want to have in case you need it, but God forbid, you don't want to ever have to need it. So we are covered currently for accident and illness. So, and we're not getting too much more out of it. So, you know, we hope we never ever use it, but we're paying out all this money every year. So as mentioned, with the declining Canadian dollar, we may not be able to continue to afford the private, maybe not even the public healthcare in Mexico. So far, we have not had a positive experience with the claims with Health Itinerary. We didn't like the dentist. I didn't get reimbursed for my glasses because I didn't do it properly. What other claims? Those are the only two claims we've had. So, I have no idea what they would be like if we're sitting in a hospital and really need them. So, I do want to point out too that they are based in Merida, but you can they'll sell to you anywhere in Mexico. So, and what I learned from this process this year, and going back to the previous slide where this international health company is saying we sell international health company for worldwide coverage. That's not what we need. We're living and traveling within Mexico. We need Mexican health insurance, not expat insurance. And those seem to be harder to find, or if you did find them, then they find out you're an expat, so then they switch gears, and I don't want expat insurance. So if anyone out there knows of a company that can sell me Mexican health insurance for significantly less, I'd be very happy to hear about that. What are the rest of you finding? Is it just as expensive as we're doing? I know a lot of expats that we know still have health insurance, private health insurance through Canada, so which would be expensive as well. Like, we're not traveling, we're living here, so you know, I want private health insurance for this country. Okay, thank you so much for watching this video. Again, we're not experts, but I hope the information in this video was of some help to you, and maybe brought to light some information that you didn't think to look for. So, adios everybody. See you on the next video. Bye.